Hi everybody, today is Thyroid 101. So the gift I'm going to give you today is by the time we're done with this in about 10 minutes or so, that you're going to know more about the thyroid and the process of the thyroid than 80% of the general practitioner doctors out there, okay? I'm not saying that they're bad, it's just we're going to give you some really quality information and some wisdom when it comes to your thyroid. So if you think that you have a thyroid problem that has been not diagnosed, but you're suspicious of it, or you know that you do have a thyroid problem and it's not been handled properly, well, number one, I'll let you know that we handle it naturally here, okay? And that we use natural processes to help the thyroid out. Thyroid makes really, really big hormones, okay? And the hormone is the largest molecule in the body that the thyroid can make. And that thyroid is mainly responsible for your energy, okay? So when it comes to thyroid, thyroid is the gasoline for your cells, and every single one of your cells needs that gasoline. So we'll be getting into that too. All right, so thyroid, there's hypothyroid, which means your thyroid is not making enough of thyroxine, which the body needs to turn into gasoline, the T3. Thyroxine is T4. It is crude oil, okay? So we'll think of all your cells being cars, okay? And your thyroid mainly makes T4 that gets converted in the body to T3. T3 is the gasoline for your cars, okay? So it can't use T4 like your car can't use crude oil, all right? It has to be converted. So we have hypothyroidism, okay? And one form of that is Hashimoto's, which is an attack on your thyroid itself, the gland that makes the hormones, up in your neck. It's the shape of a butterfly. Feels like wet tissue paper, kind of. That's what your thyroid feels like. And when it gets attacked by your own immune system, okay, it's called an autoimmune problem. So that means it's not supposed to destroy normal cells, but for some reason it selected your thyroid. It's under attack, it can't make as much, and all of a sudden you're hypothyroid. And so it's named Hashimoto's is one form of that. The other form that we have is hyperthyroid, which means your gland up here, your thyroid gland, is making too much of the thyroxine of what your body does need, but it's gone overboard for some reason. What do these people look like? As opposed to hypo, fat, overweight, greasy skin, greasy hair, acne, absolutely no motivation, no energy. So if you feel like that, be suspicious of hypothyroidism. Hyperthyroidism, just the opposite. Dry skin, bulging eyes, thinning hair, hair falling out, lateral part of your eyebrow going away, missing. That's one big thing that people notice in public. We're like, wow, that person doesn't have their lateral 1/3 of their eyebrow. Doctors recognize it too as that being a definite thyroid problem, okay? So that's hyperthyroidism, and they're always fidgeting. They're always like, you see there's something wrong with them, like they have like ADD. They're always like doing something, and that is Graves' disease, okay? That is hyperthyroidism. So we have those two problems. Let's talk about the system issue of that, okay? There's one of them. When you see your medical doctor and some of the undiagnosed cases of thyroid problems, they mainly take a blood draw on you and they look for TSH, which is called thyroid stimulating hormone. And the insurance company only allows them to go after that one hormone, but there are 7 involved, all right? This is important. So since there are 7 involved, if any one of them is not working properly or functioning, or you don't have enough of it, or the cell receptors aren't picking it up, or you could have had COVID and things could be a disaster. We'll get into that when it comes to your liver and gut a little bit later. But so things aren't going well. If they're not, it's a system. So if one part of the system is not working, then therefore the whole thing fails. So if your doctor takes TSH, just one hormone, when there are 7 working out there for you in a blood draw, well, they may have missed something. Not may have, I almost guarantee you, if you have the symptoms I'm talking about, then they definitely missed something. So I'd suggest that you stop by, maybe give us a call. And once again, everything we do here is a little different than what the medical doctors do. We do things at the cellular level, okay, and subcellular level to find out what's going on with the root cause of the problem you may have. And once again, it's not easily distinguished as in, hey, what's going on? So you have to take the right labs. So we have personal labs here specifically for these problems that other doctors really don't have in their arsenal to fight this problem with, okay? So I want to mention that too. Let's go to see what the brain's up to and how things work in the body. I'll give you the whole system here. This is a part you really want to learn because this is what you're going to have over 80% of your general practitioners out there, okay? You come in, they're going like, where did you get this information from? You can say, hey, you got it from Apex Life and Longevity and Dr. George, okay? So right now, let's go over what that looks like. So first of all, we have your brain up here, okay? And then you have a gland up here, which is a hypothalamus. It releases a hormone, TRH, that goes to your pituitary gland, which is at the kind of the center of your brain, about the size of a pea. And the pituitary gland is the one that releases TSH, and that's the most popular hormone that the doctors want to take a look at. They think it runs the whole show, but it really doesn't. Let's face it, it does not. You'll see why. So your TSH comes down to your thyroid. It's that butterfly-shaped gland in your neck here. And your thyroid gland makes 10% T3. That's 10% gasoline for your cells. You don't run great on 10%, let's face it, that's enough, okay? That doesn't work too well. So you can't just depend on the thyroid making the T3. So the rest of what the thyroid makes is T4. That's called thyroxine, a hormone called thyroxine. And that gets converted in the liver, and your liver converts the thyroxine T4 crude oil to T3, which is gasoline. 50% of what's going on in the body happens there in the liver. What happens if you have a liver problem? Then you may not be converting the 50%, but it could be a lot less. So a lot less, not good. So you could have anything, cirrhosis of the liver, fatty liver. You could have enzyme problems in the liver. Your liver could be under attack by autoimmune issues too. So once again, you have to get to the root cause. The other part of this is your gut, your whole intestinal system. And let's face it, there's lots of digestive orders, bothersome out there that you can have. Anything from post-pandemic things, from COVID to irritable bowel syndrome, other autoimmune issues of your body attacking healthy cells. That happens a lot in the gut. So the gut converts T4 to T3 40%. So if you add up the 10%, 50%, 40%, there's your 100%. And that's what you want when it comes to T3. You want to get the proper amount. So anything left over in the blood system goes back up here circulation-wise to the brain, back to the hypothalamus, and it reads how much T4 is circulating, so it knows how much of its hormone to send to the pituitary gland for making more of T3. So as you can tell here, it's not just one system. It's not just your thyroid. It's not just your hypothalamus, your pituitary, your liver, your gut. It's also your adrenal glands down here, and every cell in your body needs the T3 gasoline, okay? Keeps you functioning, keeps all your cells functioning. Highly important. So if you feel that, number one, you have to have the right labs, okay? You want to have the right outcome of finding out what's wrong at the cellular level, which is what we do here at Apex Life and Longevity. Proper labs, we get the bottom cause of what's going on here, and we solve what it is. We solve what problem it is. So no medication. We don't take insurance, because if we did, we have to listen to what the insurance company would say, and then take one blood draw for your TSH. You'd never find the problem. So for all you folks out there that are suffering with this, I urge you to contact us so we can help you out with that. Okay? So thank you for listening in. Now you know more than 80% of what the general population medical doctors know. So take that information and be good with it, and good to see you.